So for the people of Canada, I think we're deeply aware that our healthcare isn't what it used to be. That the vision of Tommy Douglas, the nometer of our society, part of our heritage, part of our Canadian identity to have basic universal coverage for Canadians is deteriorating. And it's done by design. And that's where you get alarming statistics, sadly, like this. So this is from the Canadian National Observer, where they stated that polls showed that more than a third of Canadians have no doctor and seek health information online. A third of Canadians don't have access to a doctor and are resorting to online methods, according to the National Observer. So it says a new poll suggests that more than a third of Canadians say they have no choice but to seek health information online because they don't have access to a doctor, further highlighting challenges posed by an ongoing physician shortage. The online survey by the Canadian Medical Association and Abacus Data, conducted last November, found that 37% of respondents used medical advice they found online because they couldn't access a doctor or a medical professional for help. 23% of those surveyed said following health advice they found online resulted in a bad reaction or had a negative impact on their health. The survey of 3,700 adult Canadians can't be assigned a margin of error because online surveys are not conducted truly samples. The CMA, the CMA says the number of Canadians turning to online sources for medical help emphasizes the lack of accessible health care across the country, as an estimated 6.5 million people, 1 in 5 Canadians, do not have a family doctor or a nurse practitioner they regularly see. And primarily, there's a lot of factors to it, but primarily, we saw this a lot with COVID, we saw this a lot with the pandemic, is our governments, our provinces that run the healthcare system in each province cut back on the doctors, cut back on nurses, and fired a bunch of them during the pandemic that wouldn't comply with the pharmaceutical agenda. And the nurses and doctors that were treating those patients, that were treating those people, were laid off. They were told that you had to comply or we're going to take your job away. We're going to take your medical license away, which is results that happen in the state of California, that if you don't comply with big pharmaceuticals, with corporations, they seize your medical license. So you can't treat patients, even if those patients are doing well under the supervision of those doctors and nurses. So that is a huge contributing factor to this. They're getting burnt out because of the lack of funding, the lack of resources they allocate towards healthcare, and they send it off to Ukraine or Israel or to their extravagant Ponzi schemes within governments of provincial and the federal response. It's just a mess. It is a mess. And considering that as a Canadian, this is something that is part of our identity. This is something that we contribute to Canadian society, that if we have functioning universal health care, then we strive as a society to prosper better, to be more productive. Because if our nation is sick and don't have access to physicians, don't have access to hospitals and medical care, then you don't become a productive society, which is what's happening right now. We're becoming less and less efficient, less and less productive because of healthcare, education, the basic assembly, the basic foundation of society is crumbling because of just the lack of response and the lack of initiative to serve the needs of people. And especially in Ontario, we saw it extensively. We covered a lot of stories where doctors and nurses were fired, how they were cut back, how a lot of them are burnt out because as they're not getting the funding to treat patients already, now we're getting more and more immigrants, illegal immigrants and migrants into the country of Canada, and we can't even meet the needs of our own citizens at this point. How are you expected to reach out to more and more people? It's just an absolute mess that's happening right now. So CMA President Dr. Josh Reimer called the survey results extremely concerning. There is no other generation that's been exposed to so much misinformation, but has also had to face the hardship of a healthcare system that is overtaxed and does not meet their needs, Reimer said in a phone interview. Employment and Social Development Canada says the country currently has fewer doctors per capita than most countries that are part of the Organization for Economic Cooperation and Development. It says from 2022 to 2031, the number of job openings for general practitioners and family physicians are expected to total 48,900, while the number of job seekers in this group is expected to total 29,400, creating a shortage of almost 20,000 doctors. And again, there's a multitude of reasons. There's a lot of people that they're going to mention about retirement, how there's doctors that are completely burnt out, that they just see Canada as, they just don't care about the health system anymore, and they're seeking elsewhere. They're going to other countries. They're going, overseas. They're going to South America. They're going to Cuba, where there's more doctors per capita in Cuba, in a communist country. In a communist country. So for the right wingers out there, they're going to say, well, this is what you get for socialized healthcare. I mean, you have to sit and wait patiently for surgery. And it's just awful. Yeah, that means you got to upgrade it. That means you got to problem solve. You got to put the money to actual funding and resource to make it beneficial for people. You don't just get rid of it completely and left people in the dark, leave people in the burden. Because that's what's happening in America. People that are now getting dealing with healthcare denials, still are dying off in the streets. So it goes on to say the CMA says the shortage can be attributed to several factors. Many family doctors are retiring, and fewer new doctors are choosing family medicine. The association also say more family doctors are focusing on niche services rather than general care. Premier also pointed to doctor burnout as a major challenge facing the healthcare system. I don't think I've ever seen it quite as bad as it is right now when it comes to both access to care, but also the burnout that we're seeing amongst our physician colleagues, says Ream. I know we can get things going in a better way for Canadians and for the people who work in the healthcare system, but it's hard not to feel discouraged. And the other thing we also pointed out, and why so many people kind of turn away from these physicians and traditional doctors, is the amount of corruption that goes into this system, that goes into healthcare. We saw with Dr. Callie Means and Dr. Casey Means. She's a general surgeon from Stanford, top for class, and she spilled the beans on Joe Rogan about how her training, how she was told as a doctor that your duty is basically to be a salesman for the pharmaceutical industry. You're not actually supposed to treat people. You're not actually supposed to look at your patients and provide care for their health, provide alternatives like, vitamins and hydroxychloroquine and ivermectin and things like that, and alternatives that would actually help their metabolic health, which is one of the biggest things going right now, is people's metabolic health is deteriorating. That's why we have a sick care crisis in our country. They don't look at that. They just look at doctors as saying, hey, you're going to provide the gateway, so your patients are going to enlist and sign up for whatever pharmaceutical we want to shove down their throats. All these Franken pills by Pfizer and Bayer and Moderna and all these other greedy cartels. I mean, there's no way to put it. It's a cartel. It's a globalized cartel that want to subjugate your health, that want to take a population, make them sicker, and then try to longigate their illness. Not actually treat them, but just prolong their illnesses. That's what's happening right now. And we saw a lot of that with COVID. We saw that a lot with people and that's why people go to online sources. So I'm not saying all online sources are misinformation. The misinformation also comes from sadly, doctors that are part of this corrupted scheme that are also why more and more people are just sick and tired of this. Um, a survey found that 42% of respondents have tried medical advice they found online, and 31% had taken online medical advice instead of advice received from a doctor or another medical professional. Reamer added that the survey's findings are especially concerning given how easily health misinformation can spread online. Again, as I just stated, misinformation can also come from corrupted doctors that are trying to push an agenda. And if you look at some medical institutions where people go to study medical science, they're also getting corrupted because they're not talking about metabolic health. They're not talking about nutrition. They're not talking about vitamins and natural immunity and, things that our human bodies respond to better, that actually help us, that nature is going to heal our illnesses if we listen to it. We're not taught this. We're taught, hey, go to the drugstore and pick up this pharmaceutical drug. Hey, take this drug, take this pill, take this, take that. Does it actually make it better for you? Not really, but it will prolong your illness to make it feel like it's okay. It's normalizing it. I know that our physicians feel passionate about being able to provide information to their patients, but I do want people to feel comfortable asking questions to their doctors, said Remer. That is absolutely what we're here for and what we want to be there for. But for Canadians who don't have access to a doctor or can't see one in a timely way, Remer said that they are seeking information online. They should look to trusted sources such as the Public Health Agency of Canada or other organizations led by health professionals. And as I always stated, that it's important, even during COVID, it's always important to get second opinions, third opinions, look around, shop around, because really comes down to the patient. It really comes down to you. What do you want? All a doctor can do is suggest options for you, suggest options, but you as a patient have the ultimate say on what you want done. Whether you want to get an experimental vaccine injected into you, that is your choice. That's what makes it your body, your choice. Used to be the case. Used to be the case, but now they don't say choice anymore. Since big pharma lobbyists have bought out the government. They don't say choice anymore. Now it's pro-abortion. So, here's just an example of why, specifically in Ontario here, the healthcare is deteriorating, and it's done by design. Do you remember back at the height of the pandemic when, the Delta virus, all these other strains are coming out, and it's supposed to be the deadliest wave coming, and we got to prepare hospitals? What did the Ontario government, Doug Ford, do in response to that? He cut back healthcare. He fired a bunch of nurses. He fired a bunch of doctors. And he was pressured by pharmaceutical lobbies to put pressure onto those nurses and doctors to say, if you don't comply with our agenda, we are going to terminate your practice. And in states like California, they made it a law. They made an official law that doctors who don't comply with pharmaceutical lobby groups are subjugated to have their medical degrees and licenses revoked, taken away. So here's from the Canadian Independent, where they said arbiter rules 9 Ontario nurses who were fired over the COVID-19 vaccine policy was unreasonable. So 9 nurses, just in this case, there's over 100, almost 1,000 different nurses and doctors across the country that have been fired because of this practice. But 9 of the nurses in Ontario fired against the government that terminated them, that laid them off, saying, how dare you not comply with the pharmaceutical industry? Why would you treat your patients with alternatives? They came back and they actually won their case. And now the government has to come forward and say, yeah, it was unreasonable. But while those people were fired off or they were laid off, were the nurses and doctors going to stick around? Probably not. No. If you got terminated from doing your job correctly in the healthcare industry. Are you going to stick around for an apology? Especially when they were doubling down on the rhetoric of the pharmaceutical lobby? Probably not. That's where a lot of these people went overseas. They went to other countries. They went down south. They went all over the place. So this is done by design. This is done by design. That they could have easily took the money, considering how much taxes we pay in this country. They can easily take that money, invest into healthcare, make sure that we have proper healthcare, proper access to doctors. The amount of money we send to Ukraine on an average day could easily pay for more family physicians and people to access them. Easily. But we don't do that. We don't do that. We send that money overseas and tell you to go pound sand. And considering the fact that we can't serve our current people right now, and the federal government wants to send in more migrants, more illegal immigrants into this country to serve their needs, shows how crazy this all is. So no wonder why the current doctors, the current nurses are burnt out. Because they are doing this by design. They're doing this by design to hopefully deteriorate as much of the healthcare system that Tommy Douglas in 1968 implemented, a farmer from Saskatchewan implemented to this country. They want to deteriorate that as much as possible for the private insurance industry, for pharmaceutical industry, for Loblaws because they own Shoppers Drug Mart. Now Doug Ford is saying, hey, you can just use Shopper Drug Mart as a hospital if you get injured. They want to eliminate the system that 10 years ago was actually efficient. And to all the right-wingers out there that say, well, this is socialized medicine. This is what you get. This is why America is the best. America! While your Americans are dying off in the streets, getting their claims denied by the private insurers and paying huge premiums, just to remind people that in a situation like this, you have to look into it and invest properly, meaning that you have to problem solve the situation. You don't just eliminate and take it away. You know, look at roads. Roads have potholes. There's going to be problems with roads and traveling. Does that mean we eliminate all roads in Ontario? No. No, it means you put the money towards paving it, making sure it's updated, make sure it's maintained. Same with healthcare, same with education. That's all it takes, folks. But you need someone with actual initiative to do that. And sadly, Doug Ford in Ontario, our federal government in Canada, a lot of these politicians just turned the cold shoulder on you and told you to go pound sand. And this is the mess we're in currently. And it's probably going to get worse. This is brought to you by Ground News, the versatile news app and website that gathers all the world's media on one place and allows users to compare coverage. Ground News gives you the access of thousands of sources worldwide, allows you to see the media blind spots, and even gives analysis on the bias and factuality of those stories. Weave your way through the mainstream narratives, the corporate lies, and have total access to find complete information that you deserve. Click on the link below and get 15% off a subscription. Be critical, be informed, be ground.